It's Dianne with Allied Health Career Training, Home Health Aide, and we are talking today about observing client medication. This is really important and usually a big part of what you do. So sometimes we get forgetful. I do. I bet you have too, especially when it comes to taking meds. And some of our folks take lots of meds, right? So we need to help them remember. Now there's all kinds of medication reminders, and perhaps the nurse sets those up week by week or month by month. You've seen some as well, that are as simple as a little box of the 7 days out of the week. One will have an M, a T, a Monday, Tuesday, and you just open it up and the meds are already on there, and there they go. It's very simple. All the way up to a very complex, big monthly boards. I've seen some that are even have a clock timer on them, and they make noises and rotate, and then a little compartment opens up with their meds. There's so many different kinds out there. And then again, maybe they won't have a thing. You don't know. It really is just what you'll see out there. But lots of times they'll need some assistance. It's not really your job to administer meds. More than anything, we are wanting you to remind them, explain to them, and observe and report. So, things that you might need to help them with. If they have a suspension like this, it's a med that needs to be shaken well before given. That might be something they'll need help with, is really shaking that up well. Meds that are too heavy, this is heavy, yeah. So they may need assistance with this as well. And when you do this, you should really pour it into the cap first and then put it into the med cup. That way you're not, if you get too many in their med cup, you're not supposed to put it back in. So you put it in the cap, and that's okay because it's still part of the same container. Okay. Another one might be these darn things. They're hard to open, especially if you have arthritis. Yeah, so you may need to open the cap for them. Same with these blister pack things. These are very difficult. I find them very difficult, especially the ones you have to really peel back and then punch out. Liquid, can they see? You may have to measure it for them. Pour it in the med cup, get down on eye level to make sure it's the correct amount. Those are some examples of why you may need to assist them with their meds. Even if they have all their faculties, sometimes the way the meds come packaged will require them to get some assistance. Always have them take a drink of water or some kind of a fluid before they take their pills. As we age, our mouth gets dry. Not only that, but a lot of medications make your mouth dry. And having a glass of water, even just a few sips of water before you give them their meds, will keep those pills from sticking in their mouth or sticking on their tongue. And it'll help them swallow them better. So a couple sips first, then they can take the water as they take the pills. But taking a sip or two or three first is really important. Applesauce. If they have difficulty swallowing a pill, taking a few bites of applesauce with it can help slide it down, or a yogurt or whatever they choose. Never touch their meds. If a med does need to be touched for whatever reason, put a glove on. You can also help them put a glove on if they want to hold their meds in their hands, or at least wash their hand first, but don't you touch their meds. Okay? Another one, if this is an inhaler, right? This is how they'll come. You put it in here like this, it snaps down in. Now, it's hard for me to take these correctly, and surely for an elderly person, it's got to be very difficult. They should be sitting upright. Assist them to sit upright when they take their inhaler. They should exhale out, put it up to their mouth, And as they're sucking in deep, this gets squeezed. And they're to hold it in for several seconds, as long as they can comfortably, and then release. Takes a lot of coordination. They don't always get it right. It's hard. This is a spacer. This is what they usually use. This fits right into the end of it. This then, they put this in their mouth. This is pushed down to where they, the medication goes into the chamber. They can then pull it in. So they don't have to have their timing perfectly if they use one of these. See? You push it down, and then even if they're a second or two off, they can still get the drug. They can still get the dosage. So that's a spacer is what that's called. They can also, boy, I got that one in there good. Also, as you know, nebulizers. They can have it with either just the steam coming out that they put in their mouth, or they can use it with a little mask. One thing I do want to talk to you about is washing these afterwards. These should be wiped down, washed, rinsed out when they're done. Also, if they're taking a steroid or a bronchodilator, like one of these, after they're done with this, give them a drink. Otherwise, they may get thrush or a rash or something sores in their mouth. So please give them a drink, a good few, several sips, as much as they'll take after they take this. Okay? So anytime you're assisting them with medication, they need to have a drink as well, handy. I want to talk to you a little bit about parenteral or injections. Also about finger stick blood sugars. Listen, all of this is a gray area for a CNA, very gray area. Yet I know that there's a lot of this going on out there. I called the Board of Nursing, called KDADS. It's a gray area. If you're going to be doing anything like this, I would get it in writing and get trained and make sure that your place of business says that you're to do it, says that you're to do it in this manner, this way, it's okay, and being trained, and I would cover my bases. Don't you ever, the onus is on you. You are responsible if something goes wrong. You know, even if you're a med aide, even if you took med aide class, in this setting, listen, if they expect you to do this thing, you better make sure you've had the training, you understand everything, and I would still be very careful about that. Okay. By the way, this particular injection is Humira, and it is about $5,000 a month. It's expensive as heck. Are you sure you want it? I mean, really? And this is usually given once a month, you know? I mean, and then there's one like this. This is given once a week. So I would be a little leery. Right? I would be a little leery on these things, more than a little. Cover your bases. Really, you are to assist. You're to report. You're to observe. You're really not to administer. Again, nonetheless, I know what goes on out there, and you better make sure your bases are covered, okay? Because you're responsible. Meds should be stored in a cool, dark, dry place. A lot of medication loses its potency or will just completely change chemically if it's exposed to air, heat, or light. So for that reason, drugs should be stored in a cool, dark, dry place. Another thing you need to do is look for expiration dates. Every drug will have a place on there that has an expiration date on it. Every drug, whether it's over the counter or if it is a prescribed drug, it will always have an expiration date. If you see that a drug is expired, you need to make sure to report it to your office. Let's say a drug has been discontinued, they are no longer to take it. You may want to put it in a different little box off to the side so they don't get confused and take both. You know, let's say they got they changed the dose of Lasix. You should take the old one maybe and put it in a different box for a while, you know, until the nurse can get in and do that. Make sure you get direction from your office on that first. But don't put it in the toilet and flush it, or pour it down the drain, or just throw it in the trash, especially if it's a controlled substance like a narcotic, like a pain med, especially if it's that. It is so important. Not only that, but it's contaminating our waterways. It's important to have them destroyed correctly, and get with your office on exactly how to do that, and make sure you document that well, okay? That's important. If you suspect that something's going on, you're there today and there's 10 pills of a narcotic, and you go tomorrow and there's none, and the patient's in a lot of pain, report that to your office, because something might be going on. Maybe not, but maybe so. So it's important to report, okay? It's also important to report if they are declining or refusing their meds. I always like to ask why. Sometimes they'll say, oh, because that does this to me, and they may have the wrong med. Or maybe they say it's real hard to swallow. Well, meds come in different forms. Maybe we can get it in a smaller pill, or maybe we can get it in a liquid or something else. It's also important to report if they're having difficulty swallowing the med. All of these are important to report to your office. Your job is so important. Everything you do makes a difference. You're the eyes and the ears for the staff. Thank you for doing